So you've been in cancer for a while, you've worked in oncology for a while, and a lot of people know a lot about cancer, but they might not know about it on a cellular level. So could you tell us a little bit more about what cancer actually is?
Cancer is a disease that basically is a name given to abnormal, out of control growth of cells in the body. Any particular organ can get involved. This happens because we have signals in our body that tell the cells that it's time, that their life is over, they need to die. When those signals are damaged because of some genetic mutations that we may inherit from our parents, or those mutations can happen because of some environmental factors, that signal is off. So the cells, when they're supposed to die, they don't die and they start growing abnormally. And then whichever organ that happens in develops a cancer of that organ. It can develop in solid organs like breast, lung, prostate, or it can develop in the bone marrow and the lymphatics. Then you get blood cancers like leukemias, lymphomas. So pretty much any organ of the body can get involved, but it's basically abnormal, out of control growth of cells of that part of the body.
Dr. Nabi, I think you've already answered my question. It was simply, why can you die from cancer? And I guess in layman's terms, you were saying it's just kind of out of control growth of that cell.
Right. It's
just too much for the body to take.
Too much, and then it just invades that particular organ.
Okay.
Then it can spread through the blood and lymphatics, because the pool of blood and lymphatics is the same that's circulating all over our body. So some few cancer cells, they may break away from the original organ where it started from, travels to other parts, starts growing over there, and then eventually once that organ is taken over by those abnormal cells, the original function of that organ is affected, and that's what eventually leads to failure of that organ and eventually death.
Because there's so much of the negative connotation, rightly so, but when you just hear the word cancer, it's almost like the next word with it is death almost. So.
Yeah, that's how it has been. Still, since we don't know exactly why it starts, and we still don't have, the cure for it in most cases. Still, just hearing the diagnosis of cancer is almost like a death sentence for most people. But things have come a long way. We have good options now.
Speaking of those options, could you tell us a little bit more about the treatments that are available right now?
Yeah, definitely. So. The most important thing in cancer is early diagnosis. So we focus a lot on prevention plus detection as early as possible, because the earlier you can diagnose it, the best chance you have of cure. And by cure, we mean that we want to get rid of it for good, and we bring you back to your life as it would have been as if this hadn't happened. So for that, there's mammograms. Women need to get mammograms, pap smears, colon cancer screening with colonoscopies, all these measures that our primary care providers keep up with to try to detect it early. But still, we can detect it early, but in case it does happen, the three main ways that we take care of any cancer basically is surgery, radiation, and chemotherapy. And with chemotherapy now we have more options. We have immunotherapy, which is basically a different form of treatment in which we're priming the body's own immune system to work against that cancer, recognize it as something foreign in the body, and try to take care of it. So those treatments are definitely working really good, and their side effects are much more tolerable. A lot of our treatment options are now in the form of pills that patients can take at home, so they don't have to be IV infusions. That just puts a lot of ease in the treatment. Side effects are better. How we manage side effects are better. Used to be nausea, vomiting, all these things were a big problem. People would just be so scared of the side effects that they wouldn't want to actually get the treatment. But we have good ways of taking care of all of these, and things have definitely gotten much better.
And just with my brief experience with my mom who had lymphoma, so just all the things that you've shared recently, how much there's more improvement compared to what she had to go through 15 plus years ago. Well, let's talk a little bit about your work here in Enid, Oklahoma. And I say Oklahoma because we are live streaming around the globe, so people we want to make sure they know where we're at. And your work with Integris, you've already talked about some of the preventing measures and treatments and stuff, but talk about your work here at Integris and Enid, what you're involved in.
Right. So here at Enid, we have a full-time, fully dedicated cancer treatment center. We have pretty much all the approved options of cancer treatment that are available, including radiation, chemotherapy, immunotherapy, anything that's approved for any type of cancer, we're offering here.
Okay.
And then some very rare instances in which we may need to get our Cancer Institute in Oklahoma City involved, we can refer our patients over there. But for the most part, we are here full time, Monday to Friday. We see our patients, treat them, every day. We're available round the clock as well to answer their questions, any side effects that they have. But pretty much the message I want to get across is that they don't have to go to Oklahoma City for, I would say, 99% of the treatment options that are being used. And that's pretty standard throughout the country. So anything that's approved for that option, we're doing it here. There's a lot of challenges that cancer patients face from the very diagnosis. There's so much that gets done at the beginning, some scans and different specialties that they have to see. A lot happens in the beginning. So it's overwhelming, plus the diagnosis itself is overwhelming. Then they have to go all these places. A lot of challenges that come in the beginning. Then with treatment, there's a lot of visits to the hospital back and forth. So we try to make it as convenient for them, try to make it as local for them, so that they can get the treatment that they have a right to and they deserve, and they don't have to pick and choose that, just because of the fact that they live here, they need to, they can't get access to it. We try to offer them everything here.
Sure.
That's great. You mentioned that cancer can affect any organ in your body. Do you usually treat all types of cancer, or do you specifically treat only certain types of cancer?
No, here we treat all types of cancers. Anything that walks through the door, we'll take care of them. Mm-hmm. And not just cancers, we take care of blood problems as well. So any non-malignant, benign blood problems like anemias, white cell problems, platelet problems, anything else, we take care of those as well. In more bigger places, there are physicians that would specialize in a particular area, but here, we want to pretty much be very flexible and open, so we take care of anything that is related to oncology.
I was going to ask, I think one of the improvements in the treatment goes back to your previous statement, that maybe in the old days, you had to go to Tulsa, you had to go to Oklahoma City, you had to go to Dallas or wherever,
right.
Houston or something.
Mm-hmm.
But it's with the development and the facilities and the treatment, and also with individuals like yourself, an oncologist, to be able to be in Enid, that just takes a lot of people off the road.
Right, yeah, and not just Enid, we have patients coming from even farther out,
Yeah.
smaller towns, Alva, Woodward, all kinds of small, Medford. So we have patients from even smaller towns, and getting to Oklahoma City is almost 2-3 hour drive for them. And then when they're getting treatment, they're sick as such.
Yeah.
And then on top of it, driving, 4 to 5 hours during treatment, it's pretty hard. So we see a lot of patients, they, if they had to do that, they would sometimes choose not to. And they would just, decide that, it's really not something they can do. And they just have to let go of treatment. They don't have transport. So they need to find a family member, they're older patients. There are a lot of challenges that patients face in rural areas. So we try to address them as much as possible, and try to be as available as possible.
Well, this has been kind of the heavy side of our conversation this morning. We want to kind of flip the coin and talk a little bit about a fundraising event that's coming up. The event is Friday, June 14th, and Integris Sporting Clay Shoot, as you see right there on your screen, and also the Red Dirt Gala event. So I guess I can ask the first question. The event's beneficiary will be who?
This year, the event's beneficiary is the Integris Cancer Institute of Enid. And once again, for some of the reasons that I mentioned earlier, we see these challenges that our patients face every day. Every room you enter is a different story, a different background that patient comes with. Their nutrition is a very important part of treatment. As you may know, when someone gets cancer, you see that they start losing weight. The cancer is taking up all the nutrition. They're just losing weight for no reason. So they're already pretty nutritionally depleted. On top of it, the treatments that we do unfortunately have side effects like nausea, their taste buds are affected, their taste is affected. So they're not able to, they're tired, they're fatigued, they may not have the energy to get up and make themselves a good, healthy, nutritious meal. So what we noticed that a lot of our patients were, losing ground because of poor nutrition, and that was something that was beyond our control, because once they leave the doors of our clinic, what they have to face
Right.
at home is beyond us. When they're with us, if they're going to be with us for treatment, we usually serve them lunch and we have a snack bar and stuff. But beyond that, we have no control. So this is a program that has been initiated in Oklahoma City. That we're trying to benefit with the gala this year, in which we're gonna try to on the first day of our patients when they come in and they get their first chemotherapy treatment, we're going to give them five packaged healthy nutritious meals that they can just put in the microwave when they get home, and they don't have to worry about cooking. They don't have to worry, at least for that first week of their treatment, about one less thing to worry about. And that way we're trying to go beyond the doors of our clinic, try to reach them at home and try to at least get one less worry off everything else that they have to worry about. And that also ensures us that they will get the right nutrients, the right protein, carbs, fruits,
Sure.
vegetables, everything that they need, and that will help them not just get through the treatment, plus psychologically give them one less thing to worry about. So that's the program that we're trying to benefit this year. I think that's definitely a very big challenge that we see every day, and I definitely hope that the community is going to help, just like they have helped in the past. Everyone has someone that has been affected
Sure.
by this.
Sure.
A lot of us are fortunate, but a lot of us are not that fortunate to have that support system. And this is just one small thing that we're trying to do to help give those unfortunate people that support that will help them get through the treatment.
And the event that Dr. Nabi is talking about, again, is set for Friday, June 14th. Integris Sporting Clay Shoot, and also the Red Dirt Gala event beneficiary. You see it on your screen, see the key phone numbers and the website. Please reach out because it is a fundraising event.